present For the Record with Neil Heinen.
Two of Madison's most important providers of care and compassion are growing the services they offer. And that's next on For the Record. Thanks for joining us. I'm Neil Heinen. A little later in the show, we will update you on Healing House, operated by MUM, Madison Area Urban Ministry. But we begin with a discussion of the Care for All endowment and Agrace Hospice and Palliative Care. And I welcome to For the Record the Chief Development Officer for Agrace, Marcia Whittington. Nice to see you again, Marcia.
Nice to see you too, Neil.
You know, I want to believe that we've gotten to a place now where people appreciate and value hospice care. It took a while.
Absolutely.
The community conversation took some work and effort. But I don't want to assume that everybody knows how Agrace operates. So talk a little bit about Agrace and kind of how it's grown in the last 20 years.
Absolutely. So Agrace started as a hospice, and basically to be eligible for hospice care, you have to have a prognosis of 6 months or less. And we started actually as a volunteer organization over 40 years ago. Yeah. And the care that we provided was basically in people's homes. Right. And that's still where the majority of our patients are. In 2001, we built the Don and Marilyn Anderson Center, which was the first inpatient unit in our region. And within 3 to 4 years, we were building onto that with the Ellen and Peter Johnson residence. And now we do have 50 beds out in the Fitchburg area. But as I said, we're serving almost 1,000 patients a day, and most of those patients are in their homes. And that's how hospice originated.
I guess I think that the facility out in Fitchburg really helped broaden the awareness of hospice care and some of those options for people who might have been uncomfortable with the idea of having care in their homes. And you know, kind of concurrent with that was a bigger community conversation about hospice care and what it can offer for families and alternatives to being in the hospital. How are we doing with that conversation? I mean, as a whole, as a society, how are we doing with end-of-life talk?
Well, obviously, it's a difficult conversation, and we continue to work diligently to make sure that those conversations happen early. Oftentimes, we are told by families, I only wish I could have utilized hospice sooner because their loved one may have only had a week or two with us. And so we're really working with general community, we're working with the physician community to make sure that we're educating them on what our services are. And it's not just physical care. We also focus very much on the emotional and the spiritual care of someone at the end of life and their families. Yeah. Because we look at the family as we're trying to provide not only support while they're going through the death of a loved one, but we also want to provide what we call a healthy survivorship. So allowing their family to go on and to not forget, but to be able to live a productive life and with a positive memory of their loved one.
Yeah. I'm sure it's unique to each individual and each individual's family. But how do you help facilitate the conversation about in-home versus inpatient versus the kinds of services that hospice can offer?
Sure. So obviously when we talk to patients, we want to know what their wishes are. That is our main goal, is making sure that if a patient desires to stay in their home or what they consider a home, it may be a nursing home or an assisted living, then that is what we're going to try to do. When that option isn't there, maybe there isn't someone to take care of them in the home, there may not be a caregiver, or they may be in a situation where the home is not safe for them, then there is the option of our inpatient unit where they can come into and receive care. I will tell you, the majority of the people that come into our inpatient unit, they come in because symptoms are very severe. We manage those symptoms, we help the caregiver understand what's going on. And if we can get them back home, that is our end goal, because we really want to make sure if that's where they want to be, that is where our focus is also.
And the idea of palliative care, which is so important, I think, as people, you know, think about end of life and all of the elements to it, the idea of having those last remaining times be as comfortable and pain-free as possible. Palliative, I think, is a word that a lot of people don't understand.
Absolutely, and thank you for asking about that, because it is a good opportunity to educate people. So palliative care is kind of the step prior to hospice. At the point that you may become a palliative care patient, you do not have a prognosis of 6 months or less, but you do have a serious illness that does need management. And oftentimes what's happening with a patient is every time there's there's an issue, they're going into the ER and trying to figure out what's going on and, you know, trying to gain some answers. And our palliative care program can come in and help manage that, take away some of the fears, answer questions, help with medications. So it's like I said, it's still someone who is having the major illness in their life, but they're not at that level of hospice services, but they do need support in order to get through this.
Yeah. So how is the system doing in terms of insurance coverage and payment for services?
Sure. So under the hospice benefit, Medicare hospice benefit, the majority of the cost will be covered. So there is what I would say a very qualified hospice benefit. That really covers all of the hospice services. So if you are receiving hospice in your home, just about everything that we bring to you and offer to you is covered under Medicare. If you come into our inpatient unit as a residence, meaning that's where you are going to live, the piece that would be your room and board, because obviously it would be just like your mortgage or just like your rent, is not covered under Medicare. And so usually that's out of pocket for people. Okay. It's about a little over $300 a day. Which, as you know, could be definitely a challenge for some people. And so thus the reason why we developed this Care for All program was to help people that where that could be a challenge and there's no other resources, we will step in and make sure that they have the end-of-life care they need.
$15 million? Is that what?
$15 million.
And you did it?
We did it. We did it as of August this year.
Yeah. And so what does that allow hospice to do? What does it allow Agrace to do?
Sure, sure. So our goal, and we were seeing this over the last 5 or 6 years, that we were seeing people, just like I explained, that for whatever reason do not have the resources to pay for quality end-of-life care. Oftentimes we were seeing people that, you know, they were in a situation where they were in the homes, maybe they had a caregiver, but the caregiver was neglecting them. We were seeing sometimes even the caregivers were taking the drugs that should have been administered to the patients and selling them on the streets, and just really horrific situations. And we knew that we could not allow that to happen. And so what we decided to do was to build this endowment that, of course, would allow us to have sustainable funding for our efforts. It was a $15 million endowment, and our goal is anyone who needs end-of-life care and has no other resources, whether it's in our inpatient unit or in their home, we will assist them. It'll hopefully generate about $650,000 to $700,000 a year, which is about the amount that we are needing on an annual basis right now. When we started this campaign 5 years ago, that number was about $50,000, and so we knew that this need was going to change. We're seeing many people that don't qualify for Medicare. That means that they're younger than 65, and if they don't have the appropriate insurance, how do we support them? We're seeing people that we would have to take pretty much everything that they own to pay for these services, and there may be, you know, a family that's left behind, young children or a spouse, and obviously we're not going to do that to someone. And so our Care for All efforts are really to make sure that it's for those that absolutely need it. We're making sure that there's a process we're going through, but making sure that those people who absolutely need support, we are giving that to them.
Can you accommodate everybody, Marcia, who wants Agrace services, either in home or in?
We can. Currently, we're at a point where our services, we're serving just about 1,000 people a day, which when I started at Agrace 18 years ago, that was about 100 people a day. So you can see the growth that we've accommodated. And obviously, we're seeing a surge right now with the beginning of the baby boomers aging. And so we are going to continue to expand and meet the needs. Definitely in the more rural areas, we're seeing a significant need. So we've just recently moved into the Baraboo area, the Platteville area, where there are not a lot of resources for end-of-life care. And so we're taking on those areas that others may not want to serve because they're rural. It takes longer to get from one patient to the other. But we feel that that's our mission and that's what we need to do. So yes, absolutely. We are going to continue to do everything we can to make sure that we can meet the growing needs.
I mean, it's a bigger conversation as the population ages.
Yes.
But just in terms of healthcare providers, of staff, you know, I assume that that's a constant challenge.
It is. It is. The majority of our staff are nurses, obviously, CNAs and nurses. And so we have done a lot of work over the last 3 to 4 years looking to how do we grow that workforce. We're seeing a lot of our more seasoned nurses retiring, and how do we bring more in that pipeline. So just recently we've started a new grad nursing program, which for years we weren't quite sure if new grads would be prepared to deal with end of life, but we're working very closely with all the colleges in the local area to help with rotations of nursing students and a specific training for them so that as they come in to Agrace, they're already prepared, they've had some experience, and we're finding it to be very successful.
I mean, I just over the years have been amazed at how people with their first experience with Agrace and with hospice, the sense of comfort and relief that's there, maybe even unanticipated. They weren't sure what to expect. So to be able to expand availability of these services must be pretty rewarding.
It is absolutely rewarding, and you hit it right on the head, Neil. A lot of people don't really understand what hospice is. They basically think it's just my loved one is dying and they're going to come in and take care of them. And there's so much more to it. And when I mentioned before that we see referrals coming in late, a really big piece of what we'd like to do is have those referrals sooner so that we can work with the family, we can work with the patient. Many times things have been tucked under the rug for years, and those come out when someone is dying. And so how do we help people to move through that? And that gives us more time with them.
Thanks for coming in to talk to us about it, Marcia.
Absolutely,
really
thank you.
It. When we come back, we're going to talk about a new service provider, Healing House, right after this.
For the Record, sponsored by MG&E, your community energy company.
For the first time, Dinosaur Adventure roars into Madison this weekend at the Alliant Energy Center, featuring 80 life-size dinosaurs and massive family fun. Experience the thrill of the prehistoric age, featuring a 40-foot T-Rex, Triceratops, Velociraptor, and many more. Try your hands at a fossil dig, take a ride on a walking dinosaur, bounce around in the prehistoric playground, and many more dino-themed activities. This weekend only at the Alliant Energy Center in Madison. Get your discount tickets today at DinosaurAdventure.com.
Steinhoffel's Black Friday doorbusters start now. Get an early jump on amazing bonus buys priced to sell out. Plus, save 50% on all holiday decor. Plus 0% financing for 60 months. All this plus many more Black Friday deals right now at Steinhoffel's.
It's a bold new breed. It's the all-new best Outback ever. The 2020 Subaru Outbacks are at Don Miller. Now, with the Subaru Share the Love event, Subaru will donate $250 for every new Subaru vehicle sold or leased from November 14, 2019 through January 2nd, 2020. Lease the Subaru Outback Premium, $249 per month, 36 months, 10,000 miles per year. No security deposit, $1949 due at signing. Don Miller Subaru, west on Odana or east side, High Crossing Boulevard, Madison.
Don Miller.
You wouldn't frame half a photo. Then why settle for using only half of your insurance benefits? Get the full picture of your health coverage with the iCare Medicare plan. With iCare, you know exactly what benefits you have and exactly how to use them. Plus, as a member, you get even more benefits like over-the-counter items at zero added cost and $0 premium. So what are you waiting for? Call now to learn about these great benefits and more, only with the iCare Medicare plan.
Mornings look a little different in every household, but weekday or weekend mornings, most of us just want to know what happened overnight and what's up in the day ahead. So turn on News 3 Now this morning, 7 days a week, for everything you need to plan your day. The Late Show with Stephen Colbert, weeknights at 10:35 on News 3 Now.
It is almost exactly 3 years since Madison Area Urban Ministry Executive Director Linda Ketchum was on For the Record talking about the need for Healing House, the facility for families to recuperate from or prepare for medical procedures is open. And Linda's back to talk about how it's going and the future of Healing House. And joining us is Mom's Development Director, Kathy Eckenrod. Welcome, both of you. Thank you.
Thanks for having us.
3 years ago, this was just a dream.
It was a dream long in the making.
Yeah.
We had a capital campaign going on at the time, so the goal for that campaign was $1 million. It included the capital and operating, thanks to some amazing community support from CUNA Mutual, Oscar Rennebaum, individual donors, congregations. We opened the doors on July 9th, and Healing House is now available for families experiencing homelessness who have a member in need of recuperative care.
We could spend the rest of the show talking about what Mom has been over the years and the spin-offs from Mom. But what, in terms of the work of Mom, Linda, what did you see that suggested to you that Healing House was needed?
So we saw a couple of things. One of the things, at the time, back in 2012, when the Occupy Madison movement was on the old Don Miller car lot site on East Washington, the county board had asked us to ask Mom to form a task force to study why people were there, because it had evolved from a political movement to an encampment for people experiencing homelessness. So we said, we'll do that, we'll put a task force together, we'll study it, but we'll study it with the idea that we need to understand why people are there. It's not enough to say, where can we shuffle people around? We need to understand why. So we started to study this. We pulled a task force together, including people who were living at the site, clergy, advocates. We interviewed police. We talked with everyone, and we issued our report to the Dane County Board. And one of the things that bubbled up over and over again was the reality that there were children who were not getting surgery because their families are homeless and there was no place for them to recuperate. There were parents who were stopping chemotherapy because they were living in their car with their children and they couldn't manage everything plus the side effects of that chemotherapy. So we realized that there was a definite need. Our shelters are open only overnight. And where do you go from 8 a.m. until 5 p.m. when you've just had a mastectomy and you need to be in bed, you need to be taking care of yourself? So we looked at this, we started to look at what models were out there. We found models, 65 recuperative shelters, medical respites around the United States. None were specific for families, all were for single adults. We know there's a need for both. In 2014-15, First Congregational United Church of Christ came to us and said, we have a home, we have a building, we would love for it to be continued to be used as a mission site. We think it'd be a great site for families.
It was a big deal.
It was a big deal, and they committed $150,000 toward the renovation work of that, and we partnered. It's been an amazing ride to get the doors open. Operation Fresh Start, they were our general contractor. They did the renovation work. Their grad crew, many of the kids in Operation Fresh Start have experienced homelessness, so it was an incredible experience for them. And then the road home came to us and said, we're closing our family shelter, but we know how to do this housing case management, and so we partner with them. They're doing the housing case management with the families. So it really has been a community effort, a collaborative effort, and we know throughout our history at Mom, we don't do anything we do successfully without partners.
Right.
So,
well, Kathy, like so much of Mom's work, hard work. It's not always an easy sell.
Yeah.
How would you characterize the community's response to supporting?
It's been overwhelming, actually.
They got it.
People are so moved, and they're not really aware of the need. Their view of who's homeless is skewed. There are a lot of families that are homeless, family with children, people that have jobs, but they come back to live in their car or someplace else, kids that are going to school. And so when you put the need out there and put that perspective out there, businesses and individuals and foundations, people are really moved, and that's what's made this possible. We're fully dependent on donations at this point to run Healing House. We're hoping that we can come up with some more creative funding in the future, but right now we're still dependent on individuals that care about this.
So where are you? Just give us some numbers. The building is paid for. Operational expenses are what's in front of us.
Right. So our budget is about $330,000 a year, we assume. We've been issued a challenge, a $100,000 match challenge by a couple that have already significantly invested in Mom and are in Healing House in particular. They see the need for this. They have a real heart for this, and so they've challenged us with that just in the last few months, and we're about halfway there with that. But this is the kind of generosity that's going to change lives for these people.
I want to talk a little bit more about the partnerships. We're going to do that when we come back right after this.
Hi, I'm Brian from McGann Furniture in Baraboo. What does free mean? No cost, right? We've all seen ads about free things included with your purchase. Free carpet pad or installation with your carpet, free love seat with your sofa, 2 window blinds for the price of 1. But we know better, right? At McGann's, free means free. Free delivery and setup with purchases of $500 or more within 50 miles of Baraboo. Shop McGann Furniture in downtown Baraboo. You'll be glad you did.
Kickoff sale at Gobin Cars. Get a 50-inch TV with any purchase. Buy 2016 Toyota Corolla with low miles and factory warranty for only $11,995 or $188 per month.
That's right. 2016 Toyota Corollas for only $11,995 or $188 per month with your 50-inch TV.
Every car is on sale with a $3,000 discount and comes with a 50-inch TV. So just ask for my daughter, Crystal the Pistol Gobin.
Or my dad, Don the Steelman Gobin.
Gobin Cars East or Gobin Cars West in beautiful Middleton.
GobinCars.com. Attention. The Centers for Medicare and Medicaid Services has officially authorized new benefits that Medicare Advantage plans may include. To get the benefits you deserve, you can call the Medicare Coverage Helpline.
Hi, I'm Joe Namath. If you're on Medicare, this is important information. I called the Medicare Coverage Helpline and they instantly looked up my coverage. In this one simple call, they offered to enroll me in a plan that includes rides to medical appointments, private home aides, doctors and nurses' visits by telephone, and even home-delivered meals. The plan also includes dental, vision, hearing, and prescription drug coverage, all at no additional cost.
Don't delay. Call to see if the new benefits are available in your area.
Call the number on your screen now. It's free.
Call 1-800-662-3800. That's 1-800-662-3800 now.
I'm back with Linda Ketchum, the Executive Director of Madison Area Urban Ministry, and Kathy Eckenrod, who is the Development Director for MOM. And we were talking about Healing House, a new location, a place for families and families with children to go and heal from medical procedures or prepare for medical procedures. And you mentioned partnerships, which I know are so critical to MOM's work, Linda, but the idea of the road home in particular, because when you get a family and provide them with their immediate need, the idea of the other components, the other needs that surround that are often the biggest barrier to long-term success. And the road home's so good at that.
The road home is amazing.
And so is MOM, by the way.
But they're experts.
Yep.
And not only their success rate at getting families into permanent housing, but their success rate at helping families stay in permanent housing 1, 2, 3 years out. And so we knew they were the exact right partner when they approached us. We had always envisioned housing case management as a part of Healing House and the array of services. We had planned to do that, but when they came to us and said, you know, we'd be interested in doing this, it just made all the sense in the world. And so we said, yes, let's do this. Yeah. And so their case manager is on site at Healing House once or twice a week, meeting with families. We've had success. They've helped our first family who moved in to Healing House on July 9th, Ava. Ava had 2 children, an 8-month-old and a 13-year-old, and her 8-month-old needed 2 surgeries, one on his esophagus to correct some breathing issues. That had to be done before his brain surgery could be done. Those surgeries had been postponed because they were homeless. So Ava came in. Ava was in part homeless because the time she had to take away from work to care for her son, she lost her job. She lost her job, she lost her housing. This ripples out. So the ability to come into Healing House, stabilize, get her son stronger, get him through his surgeries, get back into the workforce, save some money. And Ava and her kids moved in on July 9th, and on September 30th, with the help of the road home, they moved into their own 3-bedroom apartment. So it was a dream come true for Ava. And the beautiful thing about the work that we do at MOM and these experiences is that Ava now comes back regularly to Healing House for dinner, to talk with the other residents, to encourage them. And it's not unusual for her to come in on her day off and help clean with the staff and volunteer there. So that's what it's about.
Yeah. So advocates on the street, advocates at the Beacon, advocates are recognizing families and saying, you know what, you should probably contact MOM and Healing House.
Yeah, our referrals are coming from all over. The one caveat is that we do need to have a medical professional tell us that, yeah, this is an appropriate level. So as soon as we get a referral, we're meeting with the family, we're getting a release to talk with their primary care provider and working those things out. We had a great meeting last month with all of the discharge planners at Meritor, making sure they understand that we're there. We've had referrals from all 3 hospitals. Yep. So it really is, we've been, as I said, we've been open 4 months. We've served 8 families, 20 people.
What's the capacity of the house?
10 to 12 beds, depending on the family structure and as we say, the size of the patients. So we've had a number of newborns, moms who've had cesareans, we've had kids who need surgeries, we've had parents who need surgeries. So it just depends, but 8 to 10 beds. We have 5 bedrooms, and 2 of them are adjoining, so we can accommodate a larger family. And then there's the common TV area upstairs and common room, kitchen, dining room downstairs. And it's just, it feels like a home, and that's exactly what we wanted, was a place where people just felt like, I'm here, I'm safe, I can focus on getting better.
So as we near end of the year giving, Kathy, the $300,000 will be an annual effort that needs to be raised.
Yes.
And people can come to the MUM website and find ways to give.
emum.org/donate.
And I mean, individual donations, corporate donations, this is still a very, very
Yes, it's crucial. And anything that you give meaningfully matters. It matters to the individuals that give, and it matters to the people that we serve.
Yeah. Congratulations, 3 years. I mean, that's not bad. Thanks, Linda.
We're persistent.
Thanks, Kathy.
Thank you.
We're going to come back and wrap up For the Record right after this.
Shop Wild Easttown Honda for final clearance savings on over 400 new Hondas. Lease a new all-wheel drive HRV with sunroof for only $179. Just $179 at Wild Easttown Honda in Madison. It's gotta be wild.
Get new floors during Empire Today's gigantic 75% off sale. That's carpet, laminate, and even hardwood 75% off. Empire makes getting beautiful new floors easy. See samples in your home, get a free estimate, and have your floors professionally installed. Update your floors with Empire and get 75% off carpet, laminate, and hardwood. Schedule now.
800-588-2300
Today.
Congratulations to Dominique Harvey, a cross-categorical special ed teacher at Orchard Ridge Elementary.
The way I approach it is I just think about the younger me. I wish somebody would have talked to me growing up, and someone actually like sit there and who I feel like really cared about me in the school system.
If you know a teacher who deserves to be recognized as a top-notch teacher, send us a letter, an email, or nominate a teacher at channel3000.com.
Sponsored by Lazy Boy Home Furnishings and Decor.
Every once in a while, something comes along so masterful, it leaves you in awe. So inspiring, it changes your life. So beautiful, you wish it would never end. When that happens, it's something not to be missed. Shen Yun. Returning to Overture Center for the Arts, February 4th and 5th. Tickets at shenyun.com/WI.
Register for the Turkey Trot and kick off Thanksgiving Day with a bit of exercise and loads of fun, all benefiting the Boys and Girls Club and YMCA. Choose a 5-mile run or a 2-mile walk. There's even a dog jog. Go to festivalfoodsturkeytrot.com for details.
Shop Wild Easttown Honda for final clearance savings on over 400 new Hondas. Lease a new all-wheel drive CRV with sunroof for only $249. Just $249 at Wild Easttown Honda in Madison. It's gotta be wild.
My thanks to Linda and Kathy and to Marcia and to you for joining us. We'll see you next week on For the Record.